A major cervical cancer screening clinic in Johannesburg has shut its doors, and doctors are warning that the impact will be dire. The clinic at Helen Joseph Hospital closed last month after the US government withdrew its funding through PEPFAR. It had been running for over 20 years, serving women from across the city, many of them living with HIV. Most of the staff have now also been let go. With state facilities already overwhelmed, doctors say the closure couldn't have come at a worse time. Let's unpack the story further. We're joined by Salome Meyer, who's the director of the Cancer Alliance. Salome, thanks very much indeed for your time. Another devastating development in the healthcare sector. And just for context for our viewers, cancer, in terms of cancer deaths in South Africa, cervical cancer is right at the top of that list.
That is quite correct. It is also the second highest cancer in terms of incidence in this country. South Africa is one of the leading countries with cervical cancer, and one can say that one woman dies literally within 72 minutes per day. So it is a staggering number of women that die,
Sure.
And we need to do something about it.
I mean, was there no way for, even through government funding, to keep the cervical cancer screening and prevention clinic open at Helen Joseph?
The problem that is currently facing health in this country is that health is in a severe crisis. So, and I'm not saying that provinces are not doing what they supposed to be doing. But unfortunately, with all the health cuts that the provincial departments have been seeing, this comes as an additional blow. So the funding that was received from outside of the country is now impacting. And let me also say, Helen Joseph is not the only one. Mm-hmm. There is also the Khayelitsha clinic that had to close down, and they were busy with a screen and treat model to research that for South Africa. That also had to close down. So we're seeing that across the country, that the impact of the cut of funding from the United States is now impacting not only just the HIV community, but it is now penetrating community services for other, I want to say, for the ordinary woman in the street.
For this particular clinic at Helen Joseph Hospital, Salome, what would have been the funding needed, shall we say, for a year of operation? And within that year, how many patients would the clinic have?
Now, that information I would not necessarily have. The fact of the matter is that Helen Joseph becomes a referral hospital. So you need to basically start seeing what is happening with regards to cervical cancer services. And specifically, this project was linked to the WITS research unit in terms of the impact of cervical cancer, HPV, with women living with HIV. And that we know is a very definite connection. What we have to do in the country, and this is where the National Department of Health needs to come on board, is in fact the elimination of cervical cancer strategy needs to be finalized. That is number one. And that brings the buy-in from all the provinces to start addressing the problem. And then we're starting to talk about the referral pathway for women, that once you are screened and you are screened positive for a precancerous lesion or for HPV, that you are managed appropriately and as soon as possible. What I can also share with you is that we have Unit A together with CHAI that is going to invest a great portion of money in South Africa to specifically look at the next level of treatment. And that particularly comes with women who actually have been then diagnosed with that precancerous lesion, and now you have to be treated. How do we make sure that that woman is in fact treated at a facility that is in fact closer to her? So whilst, yes, we know that Helen Joseph have closed down, we do hope And unfortunately, the detail, the granular detail of the Unit 8 funding is not yet available. So we will not know which facilities in Gauteng, for instance, will specifically benefit from this funding and how that would actually then impact the Helen Joseph Clinic.
Yeah, I can see here that the clinic offered critical cervical cancer screening, follow-up services, pap smears, and a whole range of other exams for any abnormalities. And it served around 1,400 patients every year, so 1,400 patients every year. Will hospitals like Rahima Moosa and Chris Hani Baragwanath be able to pick up those patients that would have been served at this hospital?
We certainly hope that they would be. But again, I need to say, what we need to do is in fact decentralize so that that women can access services closer to them. So if you actually go and follow the track of those 1,400 women, you actually will most probably find that each of those women had to go from the clinic where they were initially identified until the time that they reached Helen Joseph, had to go and visit 6 different facilities. And this is exactly what the new Unit 8 funding together with CHAI is going to try and unlock, so that we rather bring the services closer to the women. And that's why it is not really at this stage of the game easy to say, will the other hospitals such as Rahima Moosa or Chris Hani be able to pick that up? We actually should hope that the facilities that are closer to that woman would be able to pick that up.
Yeah, and I see as well that many of the women who were receiving treatment at the cervical cancer clinic at Helen Joseph, they come from underserved communities with limited access to specialized care already. So it's not like they had many other alternatives. If this continues and worst case scenario unfolds in terms of Rahima Moosa and Chris Hani Baragwanath not being able to pick up these additional patients, how do you see this playing out in the next few years?
Well, what we really will see is that we will just see an increase in the number of women who are treated with late-stage cervical cancer. Cervical cancer is the most preventable cancer. First of all, it can be prevented with the HPV vaccine. That is now vaccinating our young girls. However, it is the screening program that is so important, where we need to actually make sure that women get screened. And that's why the screening program was so important, because it was focusing on women living with HIV, knowing that those women are actually more susceptible for cervical cancer, and therefore their regular screening with HPV, high quality DNA test is very important. And then once they are actually pick up that there is an HPV, they need to be treated for their precancerous lesions. There is another exciting development that is happening in South Africa, and that is the aspect of thermal ablation. Now, thermal ablation is being conducted in other countries by nurses. That means we're taking the service right to the primary healthcare center. However, in this country, nurses are not allowed to do thermal ablation. And that is where the National Department of Health is currently liaising with the Nursing Council to make sure that thermal ablation also becomes part and parcel of the services that can be provided by nurses. And once we've actually unlocked that, we again will be able to make sure that services will go closer to where women live. And in that way, we will ultimately start dealing with the current problems that is being impacted by external funding.
Massive blow for those living with HIV, obviously, for people who don't have access to this kind of immediate care in terms of being screened for cervical cancer. But I imagine also for the clinicians who worked for the centre, who are now without a job.
Totally, and I think we need to say that every single clinician, specifically those that work in cervical cancer, are so committed to actually look at the elimination of cervical cancer. And now their hands are tied and they cannot actually live that dream. If we actually think that cervical cancer can be eliminated, the World Health Organization then have actually the targets is 90, 70, 90% of women that are vaccinated or girls that are vaccinated, 70% of women that are screened with a high quality test for their HPV, and then 90% of women actually treated for those precancerous and cancerous lesions. We can do it. So we've got committed clinicians. We just need to literally, I want to say, unblock the health system.
Yeah, we know the money is there. We just need it to go where it is needed. Salome, Meyer, let me thank you for your time this afternoon. She's the director of the Cancer Alliance, and hundreds of patients now likely to be transferred from the cervical cancer screening and prevention clinic at Helen Joseph Hospital to other nearby hospitals, hopefully. That's 1,400 that the clinic was treating every single year.